Hi, I'm Nikki, and this is going to be some support for hip arthritis. So if you have hip pain, you do these exercises to tolerance. You don't want to go into pain and make it worse. But by doing some strengthening and stabilizing gently, sometimes you can gain more range of motion and stop losing range of motion in your hip joints. So the first one depends on your knees and whether you can kneel without pain. But this can be really good to decompress the hip joints, often with arthritis and dysfunction. There's a compression component. The joints, have lost cartilage. Sometimes they are compressed, and decompressing them can help, as well as the strengthening and stabilizing. So if you can kneel on a cushion, like this is just a folded blanket, without pain, then you do this knee kneeling where you go into one side at a time. So I sometimes do this also just on my bed, go to the end of my bed and go kneel on the end of my bed, and it's a little bit even more cushy. And you can go into one side, reach that thigh out of the hip into the floor. So the knee and leg lengthening, giving space for this groin area. And so then you can lift the leg up completely and seek balance and do that a little bit on both legs. Knee kneeling, trying to go one leg at a time. You can keep the toes down. You could even lift this other leg up, maybe play with lifting off the floor that way. Different ways to do it, but we're rooting that thigh out of the hip into the floor, getting space in here. If the knees don't tolerate this, on the floor like that, on a blanket, on the bed, or even like this on a cushioned chair, then you might want to have a partner or friend pull and traction, pulling your leg out of the hip for you, or just simply reach, heel, leg out of the hip, and then you still can get some decompression actively, reaching that leg out yourself, out, down into the floor, up a little bit, down a little bit. As you reach and lengthen, we'll give the same kind of decompression. Awesome. And then we're going to do a modified child's pose that can be stabilizing for the hip joint. It's a ball and socket joint, femur in one of those hip bones. And again, you can always cushion the knees with a blanket like so. And so what you're going to do is one at a time, one ankle goes over the other ankle, and knees are fairly close together, one ankle on top. And then you're going to lift the sitting bones up and back. And then, of course, depending on your knee joints, your hip joints, you stop where that end point is for you. The hips might go all the way to the heels. They might not. And just hold and breathe. I'm a big fan of the full exhalation or sigh because it's always healing and tells your nervous system to go into parasympathetic mode, which is where we rest, digest, and heal things. And then do other ankle, switch it up so the other ankle is on top. And then same thing, sitting bones up and back. You might be stopping here if that's where it feels like you're not overdoing it, or it might be really surprisingly feeling good and you want to go further back. You rest, shake out your head, deep breath. And with anything that we're doing that's bending the knees as much as they can go, it's nice to stretch them out and lengthen the leg out after that. And so same with after your lead kneeling, if you do that one at a time, balance, decompressing the hip joint with the knee kneeling. After that one, it's going to feel good for the knees to do the simple stretch and great for the calves to heal back. Awesome. And then this is one simple way to actively strengthen and stretch the hip at the same time. And I do have this on my earlier hip video that's on my YouTube channel called Hip Balancing. But when you have hip arthritis, especially when it's advanced, you don't want to do many passive hip stretches, you know, like pigeon or even a figure four stretch where you come in that way might be too much. You want to do more active range of motion exercises. So this is one where you can rest onto your forearms, elbows and shoulders under the ears, and you can even rest the head down. And then it's a combination of the side lift, sometimes called fire hydrant, like a dog peeing on a fire hydrant. And you can alternate legs. And even here, you can try not to sink, compressing those hip joints and groins. But anytime, even just hands and knees, can you have a little bit of space in here, thigh rooting down out of the hip. And then alternate legs. So one side, then the other for that hydrant. And then we'll do some different versions of this type of, it's called abduction or abduction, which strengthens these outer hip muscles. We'll do different versions of this, and when they become easy, then you add a band around your lower thigh area above the knee, or press into a wall when it becomes easy to do it just with your own weight. And then you can do back and up, lifting the foot, kind of like a donkey kick. And just the same thing, going to your range of motion that feels good. So as you're using these hip muscles, and in this case, the hamstring a little bit, it opens up the front hip and front thigh. Woo. Breathe, rest your head. And just a few more. So you get it several times with the fire hydrant and the donkey kick. Awesome. And then the core strengthening of the lower and deeper abdominal muscles is going to be really important for stabilizing the lower back, back of the hips, sacrum, SI joints. So bird dog is where you draw the belly muscles up to the spine and you do opposite arm and leg extending away from each other. And then you weight lift the belly and the organs, the digestive organs, drawing everything up. Belly button and everything under that belly button up to the spine. You could add challenge by doing some movement, knee and elbow together, and re-extending. And then try the other side. Other leg and arm should be opposite. Find your stabilization. Instead of arching the back, draw the belly muscles up. Leg doesn't have to go that high. We don't want to end up arching the back. Same thing, if that's challenging, just hold. Or knee and elbow together, re-extend. Keep drawing the belly muscles up. And there is more core stabilizing exercises in my other videos. You can do the very basic ab strengthening And then you could do the fish out of water one to challenge yourself more as you get stronger. Excellent. And then we're gonna have a seat and just do a simple palm press into your outer knees. And you're gonna press your outer knees into the palms, palms in. So you are working your chest and your arms a bit as you activate the outer hips. You can do that in a few different places. Knees together with the press, a little bit further, a little bit further. Good. And then we're gonna lay back down onto the floor and just have a blanket or a block handy. At some point, we're gonna press into the blanket or block with it between the knees. But first, if you are at a place where you still have a lot of pain in your hips, then besides the knee kneeling that we started with, and that modified child's pose where you have one ankle on top and then you draw the hips back, you can also just bring the knees in towards each other and then see how far apart you can walk the feet out. So you get this bilateral, meaning both sides, internal rotation for the hips. Because oftentimes it's internal and external rotation that gets limited. We have hip pain, right? So see how much you want to do that. It might feel good just to start small so you don't go into the pain at all. Or you can walk the feet further out if there's no pain, or you could do one side at a time. One knee stays up while the other knee goes down, inside towards that other foot. And then other side, if that's feeling good. Again, we're not wanting to go into any pain at all. Great. And then a more active abdominal work with some isometric adduction, adduction, where the legs are going in towards each other, is simply block, or you could do a folded blanket or a towel between the knees, just so you have something to press the knees into. And as you inhale, you can relax, expand the belly. And then as you exhale, you're doing 3 presses. Knees into the block or blanket. Kegel, squeeze of the pelvic floor like you're holding in the P. And then belly muscles, belly button down towards the spine. If you're not sure about whether you're doing the belly button drawing down, you can even think about down and up, you can cough. If you cough, you'll feel those deeper belly muscles. If you come to the hip bones on either side and just drop the fingers down and in a little bit there, you will feel that muscle when you cough or when you just actively draw the belly button down and up. And so we do that maybe 10 times. Inhale, relax, expand the belly. Exhale, knees into the block. Squeeze the pelvic floor like a Kegel, and belly button down and up. And again. So I realize this is like watching paint dry, but that's why it's an inside job, right? And if you feel like you need to go to a PT and have them give you feedback with their fingers to tell you, yes, I feel you contracting the transversus abdominis, that can be helpful. Let's do one more time. Relax as you inhale. As you exhale, knees together. Kegel, pelvic floor squeeze, belly button down and up. Very good. And then we'll remove whatever is between your knees. And then I'm gonna do the clamshells, and like I said before, when they become easy, you add a light band. And there's lots of different bands out there that are of different tensions, from light to heavy. And these ones I got at my PT's office. It's Langford Physical Therapy here in Albuquerque. But you can go online and find bands and just look for ones that have at least 4 light to heavy density. So with the clamshells, you're holding the toes together. You can be propped up or resting down, whatever you want, and you try to keep that hip stacked over the other one rather than rocking back. Because when you lift the knee, it's my left hip that has more arthritis than the other side. So when I first started the clamshells, to avoid the pain, I would only go a few inches. And then I also wanted to encourage with my hand, am I protecting because there's really pain or because I am scared there's going to be pain? Sometimes there's a difference. And so now I am going higher. Now that I've stabilized my hips and strengthened, I've actually gained range of motion. And you just try to lift the knee up without rocking the hips way back. And then when that becomes easy, you do them with the band. And so you can try maybe 10 on each side or until you're so tired that it's super hard to keep going. And so start with no band, and then when they become super easy, you can add with the lightest density band. And then roll over and do some on your other side. Clamshell on the other side, propped up or not. Trying to keep the hips stacked. And then 8 to 10 on the other side. Excellent. And then after those clamshells, we'll do some glute strengthening for the butt muscles. And with these, you start in a bridge. And that's as high as your hips want to go. And you can still do the pelvic floor squeeze, belly button to the spine. And then it's little marching steps. You feel one gluteus maximus take over. And then as those become easy, you could do one leg up and you do the hips up and down. And if it's really hard, just start with 3. And then switch to the other leg, lifted. Lift the hips up and down. Up and down. And obviously the knees and the hips are very connected, so a lot of the exercises you're going to be working both. Excellent. And after using those big glute muscles, you could also straighten one leg out, give that nice decompression, and then go up and down using the hip flexors. If there's pain with that one, then you might need to focus on the glute, but strengthening more if it hurts to do those straight leg lifts. And then I'm going to take my more medium density band, put it around, and then you can add on to these bridging things with some abduction, abduction going out to the side and strengthening the outer hips even more. So similar to the fire hydrants we were doing and the clamshells, fine tuning, getting all the different muscle fibers for the hip abductors. And you could leave the knees out, bring the feet together, and then go up and down. And this band is giving you resistance. They show you the front view. You can see the band gives me resistance because I push out. Same when I do these hip lifts, I have resistance into the band. That all these muscles are engaged as I do the hips up and down. And you could even do the legs straight up with this band on. And then press out and in here, still getting different abductors. Lots of great ways to strengthen and stabilize these hip joints and make them happier. Awesome. And we'll do a little bit more of those standing and at the wall, a couple different versions. But if it doesn't hurt you to do this butterfly, reclining butterfly, or in Sanskrit, it's Supta Baddha Konasana, you can do this and then press into the outer feet and lift the hips. It's kind of a balance. You can have your arms out to help support you. And then you get a lot more great glute strengthening here. Because we don't want to do passive stretching of the hips in general when we have arthritis. That's often why people stop going to yoga class, because they have hip pain, and then the passive stretching makes it worse. So you have to have these active strengthening exercises included. Okay, and yeah, I showed you the single leg bridge. And so then the last two things are options with a band standing. And this can be, sometimes it's called monster walking, where you just go like this and focus on one leg abducting by itself as you walk to the side, then the other side. And keep the belly engaged, belly button to the spine, that squeeze and lift of the Kegel. And so monster walking side to side, you can count 10 to one side, 10 to the other, or you could do this kind of thing, adding some balance, the leg lift. You could do a clamshell standing, adding some balance, like that. And of course, this will be much more effective with the band than without any band. Once you get stronger, you'll need these bands. And then there's the feedback from a wall. So this is a favorite new exercise that's great to help for hiking and keeping your hips and knees great for hiking. So you have to have a little bit of room at the wall so your arm can slide by. Lift your knee up a little bit and press the whole outer leg into the wall, more of that abduction. And then you're gonna, as much as your knee allows, squat. Stick your butt out as you press into the wall. This is really hard, much harder than it looks. Bend and straighten. Now, this one's pressing into the wall. The standing knee, you press away from the wall so it doesn't collapse. Try to keep that knee centered as you do this. And then, of course, turn around. Arm can go side to side. Press. Move this mat. Try the other side, knee into the wall, press that whole leg into the wall, squat, stick your butt out, and straighten. Squat, try to keep this knee centered, not collapsing to the wall. One knee into the wall, one knee away from the wall. It's your choice how much you bend the standing leg. Woo! And this one is so hard. So hard. And then there's also different ways you could just do a skiing position and press your hands into the outer knees, knees into the hands. Again, easy way to build abduction. And then last idea is if you're in a low lunge, same thing, press into that hand into the outer knee. And then when I got the arthritis badly in the left hip, before I strengthened it, it was really hard to lunge at all in a low lunge, and even harder to go up to standing and back into the lower lunge because it had gotten so weak. So once you get those abductors strengthened, you can try to go from a low lunge up to warrior two without the knee going to the inside. Keep that knee going to the outside. So if I show you from this way, see how tempting it is. Whoa, it can easily go inside, so I keep trying to draw it out to the side. And so now a good exercise is going warrior from Ardha Chandrasana, standing, knee to the side, don't let it collapse. You can either just go from that, you could also play with Shiva squat, back to the low lunge, knee to the outside. Good. And actually, if you have been doing that with me, let's do the other side. Low lunge, press that outer knee into the palm, palm into the outer knee. And then keep that knee drawing to the outside as you come to standing. So just going from a low lunge up to standing, like you're going to do warrior two, takes a lot of hip strength. And if you have arthritis, it's going to hurt if you don't do it strongly and mindfully. We don't want to just fudge it. And then you can try, if there's no pain, warrior Ardha Chandrasana. Try not to let the knee go inside. Keep that knee drawing to the outside. Excellent. And then if you do feel like your butt gets tight from all of this strengthening and stabilizing, there's this simple knees to the chest, rolling the hips around, knees over the hips. You can do legs straight up, side to side. Just give your sacrum a little massage on the floor. Or you could do a rolled blanket under the hips to massage. You could also use a rolled yoga mat or a pool noodle. And then it massages the back of those butt muscles that we were just strengthening a lot. And so all of these made it so that I could actually sit cross-legged again. When I had that tipping point going into moderately severe osteoarthritis, I couldn't even sit cross-legged for a while. I've always had more internal rotation than external, but now I can sit cross-legged again. And sometimes you could also play with pushing. We did a little bit of both, but we did a little bit more of the abduction more than the adduction. But you could play with pressing into the inner knee with your palm. Push and see if that ever makes it easier to sit comfortably cross-legged. So things to play with, food for thought. I think that's everything I wanted to cover. You can let me know if you have any questions. nwfeldman@gmail.com. Good luck keeping those hips and knees in good shape.